Hi, everybody. I'm back really early this time. Like, there was not much time between one video and another, but I wanted to give you some information. Ugh, I'm a little tongue tied again. So I wanted to give you some information that I might not have been able to before, but this is information regarding the drug Tepezza, and it's made by Horizon Pharmaceuticals or Therapeutics. And basically, it's all about treating thyroid eye disease, which, whoo, I have. Big shock, right? Um, so I've never had this drug. I've never taken this drug. I don't, claim to have personal. I do want to just discuss some of the side effects that are listed on the drug sheet. There's muscle spasm, nausea, hair loss, diarrhea, fatigue, hyperglycemia, hearing issues, um, skin issues, taste changes, headache, IBS problems, neuropathy, and asthenia, which is basically the lack of feeling sensation. Um, I have a husband who is on a therapeutic and he's controlling cancer. It actually drives him bananas because he can't feel his feet or his hands, and that makes it really hard. I mean, imagine trying to button your shirt up and then realizing that you can't because you can't feel your hands. It just makes life difficult. You know what I'm saying? So you have to kind of weigh the pros and the cons of different things. So if you're treating eye disease, then you're going to want to, I don't know, you're just going to want to weigh those pros and cons. So I had a little chat with a really good friend of mine that I actually grew up with almost my whole life, right? I've known her since I was a little kid. And I just remember it was a while back, her telling me that she had gotten her doctorate in, and I wasn't really positive what it was in, but I knew it was like in the ENT neighborhood. So I checked in with her because some of the members of the group that I admit, because it is starting to pop up with these problems, she suggests that you get a baseline hearing test to start with. So before you start Tepezza, get your hearing tested. See where you're at. Maybe you had problems all along, you just didn't realize it, and Tepezza is just kind of amplifying that. But she said that she would highly recommend being monitored every 3 to 6 months while you're on this therapy, or until you're finished. And then if you have some issues with your hearing afterward, then maybe continue on seeing them as advised. But this is who's pretty well trained in hearing and hearing loss. So I also learned that gosh, this is just completely unrelated, but something that I wasn't aware of is that if you have been working and you were insured and then you became uninsured during that time and you're on COBRA coverage now, I didn't know this, but actually your COBRA coverage could be a completely different insurance, and it could be a completely different appeal process. So, you might have appealed to one insurance company and, they maxed out the amount of appeals that you can do. And then if you have lost your job, and you go on to the COBRA coverage, that could maybe restart your ability to get appeals to get on this drug for the treatment of thyroid eye disease. I am not pro or anti Tepezza. I am pro advocacy and education and doing your homework before starting something that could potentially affect you for the rest of your life. I think that that's just the only way I can say it. So I have a good date tonight, and I'm going to go out and enjoy a nice dinner with the hubby. So I hope this was helpful. If you have any questions, or if you want to chat about it or whatever, be sure to tell me what what's on your mind. What side effect are you experiencing that you aren't really enjoying very much? Maybe there's other people that can relate. You never know. Sometimes commisery is a wonderful thing. So thank you for listening. This has been Eyes on Eyes, and this is all about thyroid eye disease and advocacy for people that are dealing with it. And no matter what the treatment, that's what I'm talking about. So thank you for tuning in. Subscribe, thumbs up, whatever you got to do to keep on coming back and watching me so we can get the word out. Okay. Thank you. And I hope you have a great evening.